Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a question that actually came up in one of the comments from my last video that totally made me think. Great question and a very, very important topic to hit. And that is, what do you do? What's the best advice to give somebody who simply will not undergo plastic surgery, facelift, etc.? That surgery is completely off the table. Now, that's a great question because reality is, for a lot of people, surgery is inaccessible based on surgeon location, having access to a specialist. Sometimes it's financial, sometimes it's health related. So there's a lot of different reasons. Sometimes it's philosophical, right? Some people are just like hard line, I will not have any type of cosmetic surgery or facial rejuvenation surgery, etc. So for those people who are aging and undergoing the aging related changes, what advice can I give? What kind of guidance can I give to help you get to a place where you feel closer to the way you want, and ultimately look as young as you feel without looking different or weird, right? No one wants that. And do it in a way that's not going to cause deformity, waste of money, and ultimately be regrettable, right? I mean, there's tons of choices, and all you have to do is just flip around on these different social media feeds and see the different marketing campaigns that are out there by the different companies and the different practices, and you find yourself very confused, head spinning. What should I do? I know I don't want surgery, but what should I do? So the content of this video is going to help you, guide you, and get you to the point where hopefully you kind of put everything in context and make a very good deliberate decision for yourself. So without further ado, let's get into this. So aging fundamentally is caused by three categories of change all happening simultaneously. And none of them have anything to do with each other. So this is what it comes down to. Skin is aging independently. What does skin aging look like? It means skin is thinning, it's losing its vibrance, its vitality, its luminosity. It shows signs of lines and wrinkles, it becomes discolored and ultimately dull, right? I mean, those are kind of the things we think about when we think about aged skin. That is what's happening independently of the next two things. The next thing that's happening is you're losing some of your facial volume, right? As we age, our facial fat begins to diminish in certain areas of the face. These are areas where we have deep fat pads that begin to diminish as time goes on. So for example, areas like our temples, under our eyes, above our eyes, many people don't think about that area. Some in the cheek, but not a ton. Most of the cheek issues are related to the third thing I'm about to mention. The lips begin to deflate, volume around the chin begins to deflate. So there's fat diminishment, loss actually happening as a part of the aging process. So that's the second change that's occurring. The third change is laxity. It's everything that is falling, right? So the jawline starts to slide forward, you start to get jowls, neck starts to sag, you get looseness in the neck, the midface starts to come down, you get nasolabial folds, corners of the brow comes down, you get fullness and sagging around the brows. Eyelids begin to get heavy and sagging. You start to see excess skin around that area, bags underneath the eyes, and in some cases, the upper lip starts to get long. So there's all these things that are happening that are causing the facial fascia to sort of unravel and everything gets longer. So 1, skin, 2, volume, 3, sagging. Those are the three sort of things that are happening at the same time that fundamentally change the shape of your face and make you look like an older person, right? And that is the struggle right there. That's the primary struggle, that you stop looking like yourself because of the aging process and you stop looking as good as you feel or looking like you feel, right? I mean, you have an image of yourself in your mind and then all of a sudden you look in the mirror, take a photo, and that's not the person that's reflected there. So 50% of aging is your skin, the quality of your skin, how your skin looks. The second half is related to the structure of the face. That's related to sagging and volume loss, right? So shape and skin. Put those two things together, you look exactly like you used to. Those two things start to age, you start to look older than you feel. Simple as that. There are certain procedures that are designed to address each of these categories, okay? So on the skin side, and this is the one I want you to really focus on if you are hardline, I'm not crossing it, I'm not gonna have surgery, period. This is what I want you to spend a lot of time and energy focusing on and making this part of your lifestyle. And this is why you'll understand. The only thing you actually can control of those 3 areas, the only thing you can control is the skin. It's up to you. Skin is gonna come down to sun protection, daily use of the proper active ingredients on your skin that help rejuvenate and stimulate and do all the things that young skin has going on, and occasionally using different treatments in the office setting like microneedling, certain lasers, etc. So you have full control of how your skin ages. If you play the game right, if you manage those changes correctly, your skin will literally never age. And if you're listening to this and you're in your 20s and 30s, or you want to send this along to somebody in their 20s and 30s, you'll be doing them the greatest favor, because that little bit of knowledge right there will change the entire trajectory of the aging process if you can implement those changes early on. Sun protection, use of daily active skincare. So that knowledge right there, management of your skin and the early intervention, will keep your skin from ever aging. If you're a little bit older and your skin has seen some sun damage and has seen some aging changes, etc., it's never too late. You can still return your skin back to its youthful look. And I'm going to talk to you a little bit more about how to do that. When it comes to volume loss, you also have some control, non-surgical control. You can use fillers to manage the changes that are happening to the volume. This is where things get a little tricky. People use volume. When I say volume, I'm talking about fillers. When they use volume, they're doing it in a way that is oftentimes non-anatomic. Now keep in mind, a normal human face has volume in certain areas, and I've outlined those areas and I'm going to outline it again. The temple has some fullness, it's generally not concave. Under eyes are fuller, they can still be a little bit hollow, but not so hollow that you look tired. Above the eyes, a little bit of volume. Around the mouth, a little bit of volume. Lips, a little bit of volume. Those areas can benefit from some volume being replaced when you start to age and you start to lose some volume. If you get into the active mistake of trying to put too much volume in the face, that's where you start getting that pillow face, that puffy face, that unnatural look that we see, unfortunately, with a lot of public figures and celebrities and things like that, where everyone gets afraid of and scared that's going to happen to them if they begin to use these things. So the appropriate, modest, balanced use of fillers is a very, very good way of replacing some volume. But here's where it gets super tricky. Normally, what I'm going to tell you is, for the third component, which is sagging, your only option is surgery, right? It's super simple. When your jowls start to sag, neck starts to sag, mid-face starts to sag, all these things, you need to put it back up. There's no other way around it. That's where techniques like the vertical restore, which is what I perform, or facelifts and deep plane facelifts and things like that, blepharoplasty for upper eyelids and lower eyelids, that's where that comes into play. But the thing is, if you try to use non-surgical treatments like fillers to try to lift the face, you're going down a very dark and unfortunate road, because not only will it not lift the face, but you're going to come out the other end looking very unusual and weird. Now, what about non-surgical treatments like lasers and things like that? So this is how I perceive lasers, and this is where I kind of categorize them. Lasers are good for skin condition, to improve your skin. They really don't have a significant role in lifting or tightening the face. And I've made several videos on this very topic about non-surgical treatments, as well as the use of non-surgical modalities and their shortcomings for facial rejuvenation. So click on those videos after this and get into the deeper details of that. But just know that generally speaking, things like Ultherapy, Thermage, Morpheus 8, all these different things that are technically supposed to lift the face non-surgically, rarely are able to do it, even to the point where if you use a lot of imagination, that you really actually see the change. And quite honestly, I don't see how it can actually prevent fascial laxity happening, and we haven't been able to show that with any evidence. Then you might ask, well, what about the use of threads? How about threads? Now, threads is probably the closest concept to being able to lift, because that actually directly lifts the soft tissues. But here's its shortcoming. Threads have about a 30 to 40% complication rate in studies that have been shown on consecutive patients over a 1-year period. Second, what threads are temporary. These are temporary sutures that are placed underneath the skin. The skin is tightened up around them, and then as the sutures begin to dissolve, so goes the face as well. So typically, people get between 3 to 6 months out of a thread lift. So threads don't work either, and you're now in a position where your hands are starting to get tied. Threads don't really work. Lasers and non-surgical heating devices don't work. Fillers don't work to take up laxity. So what are you left with? Quite honestly, you're left with accepting, and this is really important, accepting the fact that you're going to have a facial shape that's consistent with aging. And that's totally okay. Focus on the skin, make the skin bright, supple, beautiful, free of lines and wrinkles, and 50% of your looking good and feeling good is gonna come out of your skin. So it's okay that things are loose and lax. If that's not something you want to directly address, no problem. Accept that for what it is, but don't go chasing it because you're gonna run into problems, you're gonna waste a lot of time, money, and energy. Focus on your skin, put your energy into making the skin better, replace some of the volume that has been lost in a very deliberate, gentle kind of a way, and don't do it very often. I mean, we're talking about maybe once every year, or 9 months, or whatever, you go in for a little touch-up of the fillers in all those different areas that I mentioned, just a little bit. And there you go. You'll have beautiful skin, you'll have better volume, and you'll have a face that has laxity. And as long as you're okay with that, you're okay. If you want more later on, then you know that the next category you need to address is the surgical, but until you do, you're not going to pursue things that are not gonna lead to good results. So that's my best all-around advice for people who are strongly opposed to surgery is focus on skin, a little bit of volume, forget the laxity component of the face, and enjoy those changes, enjoy that effort, but recognize the shortcomings are going to be the shortcomings, and at the end of the day, this is a personal choice that you'll have to make for yourself, and if whatever is right, it's right. All right, guys, I think that is a very, very good question. I'm so glad one of our viewers and subscribers asked that because I think that's something that has been coming up a lot, and I think this is very timely to discuss this with everyone. And I hope that gives you a little bit of guidance and direction when planning your own treatments. And I hope you can drop down some questions down below. I'll do my best to clarify or answer anything. We've got lots and lots of videos in this playlist set and on this channel, so make sure you go through and you can put together the different videos that will answer any other questions that you have. We post 1 or 2 times a week on skin-related topics as well as facial rejuvenation topics, so I think there's going to be a lot here for you. If you haven't already, make sure you subscribe, share, and like so we can get it out to as many people as possible. All right, guys, thank you so much. Dr. Amir Karam.